everybody, this is Dr. Jeff from Bella Dental Penrith, and what I wanted to do was introduce to you a series where I teach you guys, the general public, a little bit about what we are experts at, which is teeth. So over the next few weeks we'll be kind of releasing a few videos that kind of show and help you understand what it is that we look for in the dental setting.
Alright, so we start off with what we normally see, which is some teeth that are next to each other, pink stuff, in this case it's going to be red stuff, called gums. Alright, now this is what we normally see. However, if I were to take like a katana blade and slice it right down, this is what we would see underneath. Alright, so the gums are still there. And then underneath the gums, there's actually roots. That go into the jawbone. Alright. Now, the bone would be surrounding each of the roots. What we didn't realize is that the outside of the tooth is actually different from what's on the insides. So the actual tooth itself is covered with this white protective helmet called enamel, and it starts at the gum line and kind of works outwards. But below the gum, the roots are completely made of this other substance called dentin. The enamel's got these little rods, and it's mostly inorganic, which makes it a very, very hard substance to destroy food with. Underneath, the dentin is definitely organic. It's a lot softer, and it kind of has more of the consistency of like chalk. So we'll talk a bit more about that later in the tooth decay video. Now, inside each tooth is also a nerve, or pulp. Right? So the pulp is full of blood vessels. It's very vascular. It carries oxygen in and out of the actual tooth itself. It also contains nerves. Alright? So this is basically the anatomy of teeth that are surrounded by bone. Now, one of the other cool things about bone is that the bone is not actually fused to the teeth. The bone is like similar to how our bones are connected. So here's my fingers, there's muscles, there's bones, and there's also like these little joints in between that connects bone to bone, and that's typically soft tissue. So those joints are actually called ligaments, alright, and they line all along the roots to the bone, which gives it that attachment. That's why the ligaments, which prevent you from pulling your finger joints or any other joints apart, is what helps to keep your teeth in the jawbone that's attached to your head. So here we have it. We've got tooth, root, there's your enamel, the yellow stuff is your dentin, purple stuff is the pulp, gums are the red stuff, jawbone. Oh, I should like put a few more Swiss cheese holes within this jawbone, because whenever we look at pictures of jawbone, there's always like little Swiss cheese holes. One other really cool thing about jawbone is that it's actually very vascular and dynamic. It's not stone and rock hard like we think it is. So bone is very, very much alive, and is a very important part of the whole dental complex. And we've also got ligaments that attach to everything. So here's your first lesson in teeth.